Hello and welcome to the MicroMolar podcast.
In this episode of our Health and Wellness series, in partnership with the Marajan Health Foundation, we're diving into a revolutionary cancer treatment, CAR T-cell therapy.
That's right. It's a topic that sounds complex, but it's truly transforming lives. At its core, CAR T therapy is a type of immunotherapy. It involves taking a patient's own T cells, a type of immune cell, and genetically engineering them in a lab to recognize and attack cancer cells.
So it's essentially creating a personalized living drug.
Exactly. And for certain blood cancers, like B-cell leukemias and lymphomas, it's been a massive success. These cancer cells have a clear marker on their surface, called CD19, that the engineered T cells can lock onto. For some patients, this has led to deep, long-lasting remissions.
And the article we reviewed highlights the impact of this in terms of health outcomes, using a metric called KWH-LI. Alec, can you break that down for us?
Of course, KWH-LI stands for Quality Adjusted Life Year. It's a way to measure not just how much longer a treatment helps a patient live, but the quality of that extra time. One KWH-LI is equal to 1 year of perfect health.
That makes sense. So it's not just about survival, it's about thriving.
Precisely. The article notes that for some pediatric leukemias, CAR T can add 7 to 9 additional QALYs. For certain lymphomas, it's around 3 to 4. These are substantial gains for patients who previously had very few options.
That's incredible. But as the article points out, this success story has a boundary. Why does CAR T therapy struggle so much when it comes to solid tumors, like lung or pancreatic cancer?
That's the billion-dollar question. There are a few key reasons. First, it's physically harder for T cells to get into a solid tumor. Second, the area around the tumor, the microenvironment, is incredibly hostile and actively suppresses immune cells.
So the tumor builds its own fortress.
It does. And third, solid tumors don't always have a single reliable target like CD19 for the T cells to find. It's a much more complex battlefield. This is why early trials in solid cancers have unfortunately shown poor results.
But researchers aren't giving up. The article mentions some next-generation strategies being tested to overcome these hurdles.
Yes, and they're fascinating. They're developing dual-target CARs that can recognize 2 markers at once, making it harder for cancer to hide. There are also armored CAR T cells, which are engineered to release substances that fight back against the tumor's suppressive environment.
So they're making the T cells smarter and tougher. What about regional delivery?
That involves injecting the CAR T cells directly into the tumor, bypassing the challenges of traveling through the bloodstream. It's a more direct assault.
So to sum it all up, where does CAR T therapy stand right now?
It's a tale of 2 realities. For a narrow group of blood cancers, it is a revolutionary, life-saving treatment. But for solid tumors, it remains experimental. It's a major step forward, but not yet the universal solution we all hope for.
The next decade will be critical in seeing if these next-generation approaches can finally bring its benefits to a wider range of patients. A big thank you to the Marajan Health Foundation for their support on this series.
Thank you all for listening to the MicroMolar podcast. Join us next time as we explore another frontier in health and science.